So today I'm going to be treating the knee using the Tecarpuls from Enraf Nonius. I'm going to go into ligament injuries. You'll see it's preloaded the intensity at level 10, that's the highest level, and it's preloaded the time to about 5 minutes. I'm actually going to do 1 minute per treatment head size on the MCL, so I'm going to bring that treatment time down to 3 minutes. We'll go across now to the patient and have a look at this from the treatment perspective. Here we are back at the knee. I'll bring the thermal camera in. You probably see there we're about 29 degrees, 28.9 degrees, but 29 degrees on the MCL. I've got the knee slightly flexed, so I've got the knee over a paper roll. You could use anything you want to. This just puts the ligament on a slight stretch. This treatment's much better for chronic ligament problems rather than acute ligament problems. A little bit of contact medium onto the earthing electrode. I'll spread that out and then put it under a fleshy part of the patient. If you've seen any of my other videos, you'll know I don't like putting it under bony parts, so I've chosen to put it under the other leg. Would be under the Achilles tendon if I wanted to earth the left leg properly here. So I'll just use the other leg instead, it really doesn't matter. A little bit of contact medium down the edge of the MCL where I want to treat here. I usually put the contact medium along the area I want to treat. Always use more rather than less. I tend to find it dries out during the treatment. The skin seems to absorb it. Start the machine here and start going around in small circles fairly rapidly. This area is going to absorb the capacitive waves very rapidly and readily, so it'll heat up fairly quickly. You may find yourself needing to turn the treatment down from level 10. You can just use the down arrow on the treatment head here. You'll see I haven't got my thumb over the down arrow. It is good practice to keep your thumb over the down arrow just in case you need to turn it down, or over the start stop button, so the start pause button basically. The reason for that is you can use either to turn the machine down. So if you're over the down button, you can just press it down, but make sure you keep the head moving. If you stop the head moving, the heat will generate very quickly. You can press the start stop button, so pause the treatment and then turn the treatment down, or you can take the treatment head off and turn it down, whichever you prefer, but you're probably going to end up turning this treatment down at some point during the session, especially if you're up in the 5 minute mark. I'm going to cut to the end of this treatment because this is a long treatment. We're going to be sat here for 3 minutes otherwise, and we'll see what the heat looks like at the end. I expect this will have changed quite dramatically, to be honest. A good treatment in chronic conditions. I'll bring the thermal camera back in now. I'll have a look at the thermal camera, hitting about 37 degrees. You can just see the heat map there right over the MCL. Good solid treatment for chronic conditions.